I opened this earlier. You can.
Switch account.
No?
Switch here, sabi eh. Ito na lang. Ito pa rin. Sure ka?
Oh, okay. Slide.
Sa limbal vasculature vessel types po.
Limbal vasculature. That would be, ouch, endothelium, conjunctivus done. Uh-huh. This one here. Are we good? Over here? Yes? Is that a yes? Nice. I can see Jamie. Oh, what happened to Jamie Irish? Yes, Elisa, I see you. There you go. Yes. Janice, I see you. Crystal, I see you. Randale, of course, I see you. Okay, there you go. All right, so let's continue. I have shown you this, the recurrent arteries, which is away from the limbal area against a terminal arteries near the limbus. Correct, Joyce?
Yes, correct.
Okay, all right. So we have sclera now. Correct? Are we good, sclera? All right, I can see the thumbs up. Wonderful. There you go. Nice. Nice. So welcome to my TikTok. TikTok? Anissa, this is a TikTok? Oh, okay. Anthea, I only see your hair. Okay. All right. Let's go. So this sclera, as we all know, it's the white that we see, right? So this is approximately spheroidal, collagenous, relatively avascular. That's why. It's also relative and active metabolically and durable and tough. Okay? So at least you already know how, oh my gosh, the description of a sclera. Okay? I think I can use the other one. Where is the stand? The stand.
Ashi, where's the stand?
Where's my stand, Ash?
The metal stand
I
for
need
the
it.
iPad.
Can you please give it to me? ASAP. Now I need it. Okay, so the sclera composition, 65 water,
Ashi,
right?
where's the stand of the iPad? The stand of the iPad.
All right. So compared to cornea, remember cornea? It's about 82%, correct? Right? Guys, the CF is like being compared to cornea. So the sclera against the cornea, 65% water, that's sclera. So 72 to 82 is your cornea, correct? Are we still following, Joyce? Yes? Alisa, are we still good so far? All right. Janice? All right, so far we're good, 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 good. And 75% collagen, 10% other protein, and 1% gags. To compare again to cornea, which is 4%. Okay? So it is irregular in arrangement. So what does it mean? Randolph, what does that mean? Irregular
That
and regular. What have you learned about that? Go ahead, Randall. Go ahead.
the arrangement of collagen fibers of sclera is regular, therefore it will be opaque. Unlike the cornea, it is arranged regularly, so
Correct.
the cornea is transparent.
Very good, Randall. Good job. You will do well with your quiz. Very good. Because as you all know, not only is it devoid of blood vessel, but also the arrangement makes it transparent. Correct? Is that right? Ah, okay. Let's see that view from this. Where am I? Ah, okay, so that we can all see each other. There you go. I'm also here. Hi guys, can you see me now? Yes? Yeah. All right. Okay. Next, the dimension. Approximately spheroid, about 22 millimeter in diameter. So it's relatively big, right? 80% of the eye external surface is your sclera. So meaning to say, if that is 80%, the remaining is your cornea, correct? Correct. Very good. So it's like, remember, optometry is all about, yeah, it's so easy. If you have 80% here, yes, Randolph, right? If you got 80%, so the remaining, of course, obviously, you only have two to think of, the cornea and the sclera. Am I right, Randolph? So do you have to memorize the cornea? No need, because you already know that the sclera is already 80%, correct? All right. So about 0.8 millimeter at limbus, zero point 0.6 in front of the rectus muscle tendon, zero point 0.3 behind rectus muscle insertion, about 0.4 to zero point 0.6 at the equator of the globe, and 1 millimeter at the optic nerve head. So this is your dimension. Okay? Now, let's talk about glands. All right, remember the LM, lacrimal? Is it lacrimal? Lacrimal is LA, right? Which is the aqueous. Wherein LM is lipid meibomian. And then MG, which is an MG car, is mucus layer, which is the goblet cells. As simple as that. We already discussed that, right? So let's discuss it in details. Okay, so the lacrimal gland is located under the superotemporal orbit, sits in the lacrimal fossa, divided by the levator palpebrae superioris into the orbital portion, which is the larger upper, and the palpebral portion, smaller and lower. Okay, so far it's pretty much straightforward, correct? Correct? Okay, it's straightforward. There are 12 lacrimal ducts. Okay, so 2 to 5 from upper, which is the orbital portion. You have 6 to 8 from the lower, which is your palpebral portion. So the ducts are opening, right? Ducts open onto superior palpebral conjunctiva and with the accessory lacrimal gland, which is glands of Cross, similar structure to lacrimal gland, which is in conjunctival mucosa near the fornix. What is the fornix? Can someone explain the fornix? What is the plural form of fornix? Of course, fornices. So what's the fornix or the fornices or the fornix? Can someone explain to me the fornix? Yes, Joyce, go ahead.
Fornix is the link or the junction between the palpebral and the bulbar conjunctiva.
Very good, very good, very good, very good. That's why sometimes when you invert, right? When you invert the like this, you can see me. You can see me, right? Hello, you can see me, right? Joyce, can you see me, Joyce? I'm waving at you.
Yes po, Doc.
Okay, so if you do this, you can see the fornix, right? The fornix, right? Right? Am I right, Joyce?
Yes po, Doc.
Okay, gotcha, gotcha. All right. So 20 in the upper lid, 8 in the lower lid, and it's more numerous laterally. When you say laterally, that is temporally, correct? Because the lateral, Randolph, you work out?
Sorry, Doc. What was that?
Do you work out?
Not anymore.
anymore. But you know the lateral, right? When you work your lateral, right? It's the sides. Yep.
Yes.
All right. So it's exactly that's how you can easily associate things to something that you already know. Because you already know, since you're working out, you know the word lateral. So you can just associate it to something that you know, right? That's how you can learn easily. Okay. All right. So it is actually supplied. It supplies aqueous phase of basal tear film, and that would be again another is your Wolfram, similar structure to lacrimal gland near the upper border of the tarsal plate. Right? It supplies aqueous phase of basal tear. So let's compare the Wolfram against the cross. So the cross is it supplies aqueous phase of basal tear film, while um, this Wolfram is an accessory. It's like a help. When you say accessory, what comes into your mind? Accessory? Anyone? Are you still hearing me? Randolph, you can still hear me, right? So when you say accessory, what comes into your mind?
Uh, Accessory glands are usually not the main glands, but they help the other glands of the eye to produce. It
Exactly.
needs to lubricate the eye and the cornea.
Very good. I like your microphone. I like the setup. Maybe I should do the same, right? Hi, welcome to my podcast. And with me is Randolph. So Randolph, how are we doing today?
It's very hot.
It is, huh? Okay. But I like the setup. Maybe we should do podcast there. Are you gonna invite me to do a podcast? Do you do podcast?
No.
Oh no, you just have a good setup. All right. I'm gonna do the same. Uh this Saturday, please hook me up. I wanna have the same setup. All right. I like that. I kind of like it. I like it. I like that. Do you have some sound system like woo, 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 stuff like that? Can you also do that? No sound effects? Oh, just microphone. Ah, all right. Let's do that then. That's an inspiration. That's inspiring. I'll do the same. Okay. Let me just set up the room. Okay. I'll come up with that too. Next. So all accessories, as mentioned, is like your supplement. You have your main medicine and you have your supplement, correct? They help from what Randolph said. It's like an aid or a help, correct? All right. Another is the gland of Zeiss or Zeiss. It's a sebaceous gland associated with lash follicles. No wonder if you are checking your lashes, one of the things when you're doing the clinic, soon enough, you'll be doing clinic next year, and you are to observe the lashes. And one of the recording is oily or flaky, correct? Guys, are you familiar on how to describe when you're doing your observation externally? I think that's optoprac. Is that an optoprac subject? Yes, Anissa? Is it optoprac? Have
Yes
you
po,
learned
Doc.
have you learned how to do that?
Yes po.
Okay. Very good, very good. All right. So again, partially supplies the lipid layer. Okay. Because what's the main source of lipid layer? Guys, the main source of the lipid layer. We already have an acronym for that.
Meibomian gland.
Very good, very good, very good, Joyce. LM, right? Lipid meibomian. Very good. So there you go. The meibomian gland, which is sebaceous gland, main supply of lipid. There you go, Joyce. You're correct. That's why I would say, do you need to memorize this? Come up with your own way of making it easier, right? Or simpler. Simpler. There you go. So 25 in the upper lid, 20 in the lower lid. So did Doc Sherwin ask you to count the meibom? Did he ask you? No, Joyce. No. Okay. All right. Okay. So this, of course, prevent tear spillage. Which prevents tear spillage? Of course, it's the lipid layer. Yeah. So minus the lipid layer, you now have dry eye. That's why, Joyce, some of the older folks would complain of tearing. And then when you say, you have dry eye, and they would say, why would you say I have dry eye? I'm actually tearing already, right? It's actually because of the absence or shortage of the lipid layer, correct? Does that make sense, Joyce?
Yes po, Doc.
Okay, very good. Now, again, another accessory, because we know we have a lot of accessories, like your bling bling and whatnot. So this is your crepes of Henley. Wherein you would notice this is the thing that we discussed last time, right? The crepes of Henley. Did we discuss this last time in passing? Did we? Is that a yes? Is that a yes, Joyce? No. Okay, there you go. I saw a thumbs up. All right. So another is your goblet cells, which is, as I've said, if there is anything that we understand, it's MG, which is a brand of a car, which is actually they said it's a European car inspired. Oh, it's already, yeah, it's European design, but bought by the Asians or China, correct? It's European, of course. MG is European. That's why the design is European. It's MG. So this is for your mucus or the mucoid layer. So you can say mucus layer, mucoid layer. It's okay. So have a single discharge life cycle. Next is the tear film. Now the tear film, as we all know, or the precorneal tear film, the PCTF. How many layers again? Tear film, how many layers? Joyce? Anybody? Randall?
3 layers.
3 layers, which is, acronym is?
LAM.
Very good, Lam. Very good, very good. From outer to inner, that's Lam. Very good, very good. Randall, so far so good? Okay.
Very good, sir. Very good.
Very good, very good. I like it, I like it. I like that. Tear distribution by eyelid action, by movement of the globe, helps form lacrimal lake, and each blink resurfaces tears. Meaning to say, that's why, Randall, let me ask you, whenever you're doing online class, do you even close your eyes?
I blinked, sir. I
Okay.
blinked.
Are you knowledgeable that when you are so much into whatever you're doing, like gaming or doing your assignment online or watching, that you rarely blink? Are you aware of that?
No, doc.
Now you know. Because that's the usual problem when you are like me. For example, I have a deadline. I have to finish my work. and I'm using my laptop. So most of the time, because of deadline and whatnot, you are so into what you're doing online. So the tendency is you don't blink. That's why you have to remind yourself. Okay? So remind yourselves, guys, that you need to blink. So what's the number that we're looking at? Any idea?
15 to 20 per minute, bro.
Ah, you might have dry eye already. Only seconds. Seconds. Okay. You need to blink. So if you've been like reading for 10 seconds, 10 to 15 seconds, you need to tell yourself, I need to blink. That's why when you're reading something or you're gaming, are you gaming? Do you play some of that virtual games?
No, doc.
No. Wow. Sana all. All right. Those gamers, whenever they play, they usually don't blink and they are not aware of this. So, Randall, as a doctor, you make sure you inform your patients whenever you're watching TV or playing games or playing Nintendo like my kids.
Did you know that
What?
you blink twice? You blink half the amount you normally blink when you're watching or playing
Oh,
because
wow.
you're more focused on that than blinking.
Okay. What are the types of tears again? What are the types of tears?
Emotional tears, basal tears, and chemical tears.
Wow. All right. Did you hear that, Randall? All right. Okay. So tears is very important, right? Yes. Because to hydrate, because we cannot afford to have dry eyes. And tears makes it hydrated, right? One of the purpose is to hydrate. Another purpose, it's not only that, to make the surface smooth, right? That's the function of tears. And a lot more, okay? So the tear flow is aided by the capillary action, gravity, and blinking, okay? And then the tear film stability, thanks to the mucin layer, which is an adhesion. So it's adhesive. So it makes that stick. That's why you would notice um, if you suffer from severe dry eye, you are prescribed with uh, an eye drop that is more sticky, so it can stay longer. So this is similar to your mucin layer. Okay, so evaporation leaves an oil and mucin admixture causes the breakup. Again, the admixture of oil and mucin creates the breakup in tear. You have your tear breakup, correct? Do you understand what I'm saying? So meaning to say, remember the commercial of Joy dishwashing liquid. As soon as you drop that um, dishwashing liquid, the oil breaks. Correct? That's exactly what it is. The admixture of the oil in mucin. Think of that as your um, what do you call that again? The Joy dishwashing paste or dishwashing liquid soap. There you go. All right. Now the mechanics of tear film spreading. So how do we spread the cheese? Of course, we use a bread knife. But for the eye, of course, we make use of the lid. That's why good lids, because the lids help us spread. So every time you blink, you spread the tears evenly. Not only are you spreading the oily layer, but also the aqueous layer, correct? All right. So by lid closure, because we know that the lid closes like a scissor. So it doesn't close like this. It doesn't close like up, down, up, down. It's like from temporal to nasal. That's how our lids close. Okay? Randy, do you get what I'm saying? Meaning to say, when you close your eyes, it doesn't close like up and down and then it would just like close. No, it's like a scissor. So from the temporal, it would close all the way to nasal. So in that way, it's like a scissor. And you know why? You know, creation was perfect. Our creator created that function so perfectly. You know why? Because the lacrimal lake is located where? Nasally, correct? That's why when you close your eyes from temporal to nasal, it's like pushing all the debris and the tears to the nasal side to be drained, correct? And not the other way around. Is that something that you already know? No, wow, all right. At least you're learning, right? All right, we are learning. So there you go. Tears move towards the medial canthus because of this action, correct? And for understanding, like, that's why I would think the reason why by creation it is done like that, because even the lacrimal lake is located nasally, right? So it's perfect. So perfect. Okay, tear flow by the lacrimal pump. So the upper part of the lacrimal sac distends when the orbicularis oculi or oculi contracts. So do you know the orbicularis oculi? That's your muscle, right? And that is responsible for closing, correct? There you go. So this tension induces negative pressure, which draws tears into the lacrimal sac. The capillary action and the gravity plays a part also. And the turnover rate of tears is 16% per minute. There you go. So meaning to say, we are changing. Yeah, turnover rate of tears. Okay? So just like your dead skin, we change. That's why, thanks to the lacrimal gland, thanks to the meibomian gland, thanks the MG, the goblet cells, for producing. Because can you just imagine if it's not reproducing, for sure we will all have a problem, such as the Sjogren. You know Sjogren? You know that condition, Sjogren? No? You don't know Sjogren? All right.
Crocodile chagrin po ba yun, Doc?
Yes. It's spelled Sjogren, correct? It's pronounced as Sjogren. There you go. Wherein it's a condition that there's a deficiency. It creates also deficiency of aqueous, and you tend to be dry eye because of that. So again, tear flow direction from temporal to nasal. So the direction is where again, Randall?
From temporal to nasal po.
Very good, very good. So this is your drainage from upper and lower puncta or punctae. By the way, you pronounce A as punctae, but you can, we can also say puncta. So it depends on how you want to say it, Randall, right? All right. Lower canaliculi to lacrimal sac to the nasal lacrimal duct, all the way to the nose. That's why you would notice when you are tearing, you would notice that you get to be like snotty, or you tend to have like uh, you have nasal drip, right? Correct? Especially when you end up crying, you notice, oh, even your nose is like clogging, and like that's how it is. Correct? All right. Now let's learn about eyelids. How important is your eyelid? Can you give me a purpose of eyelid? Can someone explain to me an eyelid, please?
Protects
Eyelid.
eyes from foreign bodies po.
Sorry, Brent.
Protects eyes from foreign bodies po.
Very good. By reflex, right? It will close when you are subjected to foreign body. It will close. So to protect the cornea, correct? Very good. That is one of the purposes of your eyelids. Other than that, there's a lot. Of course, spreading the tears. And of course, for, for girls, they, what do you use? They put, what do they use? And they put there, like eyeshadow. Correct? Is that something that, Joyce, are you using that? Alisa, are you using that? Eyeshadow? No one is using that. Okay. Anyways, move on. So eyelids has 4 layers. The cutaneous layer, which is the skin. The muscular layer, which is mainly the orbicularis oculi or oculi. The fibrous tissue layer, which is the tarsal plate when you evert, correct? And the mucosal layer of the palpebral conjunctiva. Are we clear so far? Any questions? Okay, Randall, we're still good. Very good. So it's a modified fold skin, and it protects, again, one of the functions is protects the eye from foreign bodies and sudden increase of light. That's why you would notice when there's bright light in fancy restaurants, you close your eyes, correct? Right? Randall? Anissa, yes? Okay, very good. And again, as I've said, spread the tears over the ocular surface. And lid margins are shelf-like and about 2 millimeter wide. So the eyelids glands, we have the Z's gland, the sebaceous gland associated with the lash follicles. Again, the moles, which is a modified sweat glands, opens into the Z's gland of the lash follicles and the lid margin, and of course the meibomian glands, which secretes the sebaceous for the main secretion of the oily layer, right? So this is how it is. You see the illustration. Randall, are you still there?
Yes, Doc.
There you go. I see you now. All right. So that's your moles, and that is your Z's or Z's, however you want to pronounce it. So the eyelids, of course, supply, it says there, the supply of oxygen to the cornea via the palpebral conjunctival vessel. Because we cannot have blood vessel on the cornea, therefore, we supply oxygen through the blood vessels on your conjunctiva, or the palpebral conjunctiva, correct? As I've said, it's like this. Take a look at this. This is how I would imagine it in my brain. So if this is the cornea, blood vessels are here, right? And it supplies circumlimbal. It supplies, because you cannot penetrate. You cannot have it there, or else we will have opacity. Correct? That's why you see to supply oxygen, you have that, and the blood vessels, of course. You already know that. The oxygenated. Correct? All right. So far, so good. Does that make sense, Radel?
Very good, sir.
All right. The illustration helps, right? My drawing is so nice, right? Like a lot of question marks. All right.
Yes.
Continue. Let's continue. All right. Now we have the physiology. When you say physiology, what comes into your mind? Physiology, Randall. Physiology.
Um, I think it's about how a muscle or an organ works.
There you go. It's how it works. Not just the muscle, not just the organ. Physiology means function or how things work. All right? So whenever we talk about physiology, it's just like saying, how is it working? Correct? How does it function? That is your physiology. Okay? That's why there's anatomy and physiology. You need to say, as you mentioned, organ and its function. Right? All right, very good. So, physiology of the cornea. Of course, we know sources of energy and the transparency. So, corneal permeability to water, which is the endothelial permeability, is greater than that of the epithelium. So, meaning to say, the endothelium, which is our A, B, C, D, E. So, water is more permeable. Where?
At the endothelium po.
Yes, very good. Very good, Randale. In comparison with the anterior epithelium, correct? So, oxygen, as I've mentioned last time, is derived from the atmosphere. So, that's why when our eyes are closed, which supplies our eyes with oxygen?
The aqueous humor po daw.
Very good, Joyce. The aqueous humor, the blood vessels. The vessels, remember? Okay. So, when it comes to carbon dioxide, we understand that if there's oxygen, there's carbon dioxide. It's like an exchange, right? As you breathe in and breathe out, right? You breathe in oxygen, you exhale. What do you exhale?
Carbon dioxide po.
Very good, Brent. Exactly. Who exhales carbon monoxide? No one, right? Unless you're a car, right, Randolph? Correct? I like something is moving behind you. Is that a machine? Oh, it's an AI. Is it an AI?
No, no, Doc, it's my dog.
Oh, it's your dog. Okay. I thought is that an AI kind of moving like a robot? Ah, it's your dog. There you go. All right. Love the chair, man. I'm loving the setup. I should set it up. I left my setup in Santa Mesa because I moved to Makati. I have a setup there in Santa Mesa with my chair and whatnot. I got that during the pandemic, but we moved to Makati and I don't have that anymore. Let's see what I can do if I can have a setup here. Because all of a sudden I envy the white chair. I love it. And the microphone. Let me see what I can do. All right. Let's continue. We have the corneal permeability of other substances such as sodium. Sodium is what? Joyce, sodium is salt. No wonder if you have you tried tasting your tears? Is it salty?
Very,
Huh?
very.
Salty. There you go. By accident. Is it by accident, Joyce, that you were able to taste your tears? Especially when you cry, right? And then tears gets in like, it's salty, right? There you go. Because sodium is part of the substance that is present, especially um, in our eyes. Okay, so endothelial is greater than the epithelium by 100 times. Glucose and amino acids metabolically is active, which is, of course, with the use of fluorescein, you can observe. What is fluorescein? Guys, what is fluorescein? What is a fluorescein dye? It's like light, right? Like when you use the fluorescein and then subject it to a black light, you can appreciate it. Have you used a fluorescein strip? Have you used a fluorescein dye? Ever? You did. There you go. Good job. Good job. All right. So, the epithelial permeability, low sodium permeability, which is your from the epithelium to compare with endothelium. So, relatively impermeable to water, lactic acid, amino acid, glucose, and large molecules. So, that's your epithelial permeability. So, relatively permeable to associated in fat soluble entities. That is for your epithelium. All right. So what's the role of cell junctions? Of course, from the word junction, it's a like connection, right? Of course, from the word connection, what are you creating? Communication. That's why Randolph Wright, you would understand sometimes you go like, whenever you hear junction, junction is all about connection. Junction of Manila to Quezon City is like, for example, in my case, I live um, we live in Manila, but at the junction of Quezon City and Manila, which is Santa Mesa and Araneta Ave, which is already Quezon City. That's a junction. There's a connection. So meaning to say, when there's a connection, there's communication. Correct? Does that make sense? Does it make sense? There you go. That's why if you try to study this way, it's a lot easier because you understand, and because of that, you get to memorize. So again, that's one tip of understanding, right? Make use of what you already know. Use the street, use whatever you have in your house, whatever you have, or whatever you're familiar with, and you associate it with that, and it will make things easier. Okay? So again, electrical coupling and barrier to electrolytes, fluids, and the macromolecules. Okay, so general classifications of junctions. We have occluding or tight, adhering from the word adherence, and each further subdivided according to the shape and size of cell. Like belts are the sonulae, fasciae are bands, and maculae are focal. Okay, so at least we understand that general classifications of junctions, whether it's a belt, it's a band, or a focal. All right. So here is your fibronectin. So this is a cell surface glycoprotein. That's why if we will understand, this releases beneath regenerating epithelium, which is synthesized by the cornea. It is utilized. That's why synthesized, utilized, used. So make use of that vocabulary so that it's a lot easier for you to memorize things. Okay? So this is found in basal and the apical surface of cultured endothelial cells. So oxygen is a very important metabolite. So what is the most important metabolite? It's oxygen. Randolph, you can probably fast from water. Like for example, if I ask you to stop drinking water, you can still survive for how many? Actually, you can survive for a long time. Aya, how long can I survive without drinking water?
3 months.
3 months?
3 weeks.
3 weeks? Is it 3 weeks or 3 months?
Assuming that you've been
Come here, I
hydrated-
cannot hear you.
Assuming that you've been hydrated before you did 3
Come here, I cannot. Closer.
Assuming that you were hydrated before that, but if you're not hydrated, probably like 3 days.
Ah, okay. So if you're hydrated, it will take longer.
Yeah.
But if
Because
you're
you
not
still have
hydrated,
water.
of course, which
It's gonna be
is
way less.
logical. There you go. Yeah, it's logical. Makes sense. Makes sense, right, Randolph? When you're hydrated, then you can survive without water for a longer time. But if you're not hydrated, then shorter time. But we know the oxygen is something that we cannot live without. Correct? We need oxygen because it's an important metabolite. So as you can see, this is the oxygen supply to the cornea from the atmosphere. It permeates through the cornea. It enters and goes all the way to decimets, if you want, all the way to the endothelium. Now, we understand endothelium is the what? What have we learned about the endothelium last time? It starts with letter P.
The pump.
Yes, it is the pumping mechanism. The pump. That's why you would notice it's like it takes and gives, right? It takes oxygen and gives oxygen, right? Not to mention, of course, carbon dioxide, correct? That is the function of your endothelium. And there goes your aqueous humor. So do you appreciate it now better? Do you appreciate now how it works?
Yes, Doc.
There you go. Very good. Now, sources of oxygen, as mentioned, mainly it's from the atmosphere, correct? About 20.9%. And of course, when your eyes are closed, of course, we have the aqueous humor or through the endothelial surface. So again, carbon dioxide efflux, okay? It is efflux, not efflux, but anyways, if you call it efflux, it's all up to you, but it's efflux. Open eye from the cornea and aqueous humor into the tear film. In a closed eye scenario, you'll have into the aqueous humor. Okay? So that's how it works. Thanks to your endothelium because of the pumping action. Correct? Right. So this is how it is. As you can see in the illustration, you have your oxygen in, carbon dioxide out. Correct? All right. Just like breathe in, breathe out. Breathe in oxygen, exhale carbon dioxide. Same with the eyes. So this is how it works. And then oxygen coming from the aqueous humor. Okay? That's why when you are asleep, Randale, when you're sleeping, you would notice there's still active pumping mechanism of the oxygen to the cornea from the aqueous humor, and to and fro comes out the carbon dioxide to the aqueous humor. So that's how it works. Correct? But if you open your eyes, this is how it works. It goes out, correct? But in a closed eye, instead of going out, it goes to the AKIS. Correct? Clear? Do you understand now? Are we clear so far? Very good, very good. Nice, nice. So this is your corneal energy by carbohydrate metabolism. You have, this is something that I need you to memorize. So come up with your own way of mnemonics, but you gotta memorize this. We have the ADP, which is adenosine triphosphate, against ADP, which is adenosine diphosphate. Should know the difference, okay? ATP and ADP. All right. So glucose is very important. Why is glucose important, Randall? What's the importance of glucose?
It is the main source of energy.
Very good. And every cell needs that, right? That's why even the cornea needs that. So energy, which is through the ATP, we have two main pathways, the aerobic and the anaerobic. So what's the difference? ATP is anaerobic, from breakdown of glucose into lactic acid, while aerobic, the breakdown of ATP, uh, is the breakdown of glucose to TCA. Okay, so you would notice the difference. If you say aerobic, glucose to lactic acid. That's why, remember yourself when you're working out. Do you work out, Randall?
Yes, Doc.
Okay, when you work out, comes lactic acid, correct?
Yes, Doc.
Very good. Everyone who works out understand lactic acid, right? When lactic acid build up, you know there's already pain, correct? Right? Do we know that?
Yes, Doc.
There you go. Aerobic, on the other hand, glucose to TCA into the carbon dioxide and water. So you see the biggest difference, okay? The aerobic and the anaerobic. That's why, again, I'm sure Randall will understand this easily because he works out. He understands the lactic acid. Okay, so you would know that's anaerobic. Okay, sources of glucose. Of course, 90% Akis humor. So Akis humor is the main source of glucose, right? To the corneal epithelium. About 90%. That's big, right? If it's a discount, wow, I would like to have a 90% discount. Who can give me a 90% discount? Randall, is there a 90% discount in
Of
my...
course, Doc.
Oh, really? Can I get a
I
90?
will give you.
Oh, wow, yay! Randall, I'll hold you to that, okay? I'll see you soon. I'll get my 90% total discount, right? So the limbal blood vessels and tears is less than 10%. So, but of course, thanks to the limbal blood vessels and tears, it still is a source of glucose, right? Not bad for 10%, correct? That's what you call beggars cannot be choosers. If you're given 10%, oh, thanks, limbal blood vessel. Thanks for that 10%. Oh, it's even less than 10%. Still, I thank you. Correct? Am I right, Randall? We're still grateful for limbal blood vessel and tears for that 10%. Correct? Because for me, Randall is like the Akis humor giving me 90%. Oh, yes. All right. Now, the glucose consumption, of course, 38 to 90 milligram or microgram, okay, per hour. It's a microgram per hour So that's how you use glucose. Okay? 40 to 66 of total consumption is by the epithelium. So meaning to say, the major consumption happens where? Where is the major consumption? It eats up 60%. Oh my gosh, that's too much. The left is 40%, and I'm sure 40% is being shared and divided by. Correct? So who consumes most of your glucose?
The anterior epithelium, Doc.
Correct. Very good, very good. Now, we'll end with this one. So this is your glucose metabolic pathways. Remember the main pathways earlier? The aerobic and the anaerobic. Where in anaerobic creates that change from glucose to lactic acid, correct? In comparison with aerobic, glucose to
Carbon dioxide.
PCA, carbon dioxide, and water.
into water, correct? Yes. All right. So now there is this three pathway, which is your glucose metabolic pathways. The MDEM or MBEM Mayer-Hoff pathway, which produces lactate for anaerobic, plus the 2-adenosine triphosphate. Next is the tri-carboxylic acid cycle, which is the aerobic along the epithelial cell mitochondria, produces, as mentioned earlier, carbon dioxide and water, correct? So this is your aerobic in anaerobic, correct? The MDEM Mayer-Hoff and the tricarboxylic acid. So I would go for ETH, right? ETH, wherein you have your hexose monophosphate shunt, which is also aerobic, produces salt. That's why you would notice it's salty. That's your sodium or sodium. Yes, they call it sodium. Are you having sodium? It's Randall, say sodium.
Sodium.
Very good. All right. Carbon dioxide and water. Very good. So, guys, let's end with that. Let's end with this, the slide 110. Because next would be normoxic condition, meaning normal condition. Condition. All right. Do you have any questions so far? Any questions so far? We have still very far. So we'll definitely finish next week on this. Right?
Lahat yan included sa quiz.
For the quiz, we'll end with this glucose metabolic pathway. From the beginning up to here. Okay? So far, so good, Brent?
Yes po.
All right. Okay. So, have no questions. Let's call it. Yes. Anita.
Doc,
Metropia. Go ahead. Randall, yes.
can we get a copy of your PowerPoint, Doc?
Oh, you want to get a copy of my PowerPoint. Okay, when we meet on Saturday. All right?
Okay po, Doc.
All right. Yes, Anissa. Anissa Metropia.
Doc, yun din po, yung sa PowerPoint ko sana para makapag-review.
Okay, I'll give it to you on Saturday. Yes.
Items.
For the retention, I want to know if you guys were listening and not just saying yes, and then comes the quiz. You go like, what? Right? That's right. What's the clue? The clue is always listen. But I'm sure you're gonna have a good outcome because you're always listening, right? Correct? All right. Let me stop sharing. Stop it. And there you go. So thanks. There you go. Thanks. Okay, yes, Randolph, please go ahead.
Doc, do we have any to bring anything for our meeting on Saturday?
For Saturday, remember, bring the following for your uh, parameter taking for ocular measurements, such as very basic, anyways, ruler. If you can have your black light, PD ruler to be specific. If you don't have that, basic ruler will work. Um, if you wanna also measure, um, what else are we measuring for the? What are the things we measure for the ocular? Um, Probably we can also do the tiers quantitatively, qualitatively, if you may. If you have your tier strip, also known as Shermers, um, some of you might also want to bring already your fluorescein dye or the fluorescein strip. We can also use that. And the saline. Guys, if you can bring saline, I suggest you buy not too big because usually you get to waste it. Downside, you cannot save it, right? But if you use a syringe in the something that you can use, I believe, is a smaller saline solution so that you can share per group. Maybe we can group up so that I don't suggest the big one. The reason why we get to waste it, it's so big, right? And then, or maybe we can, as long as it's properly handled, making sure that hygiene is top priority, we can share one big for the whole class, but making sure we practice hygiene, of course. So you decide amongst yourselves, right? Any more questions?
Doc, ilang members per group po?
I go for uh, suggested would be uh, 5 to 6 in a group. So I don't know how are you gonna do that, but just make sure everyone is well taken care of. Downside of that grouping, some of the, you know, some are left behind without any group. I would always encounter that, sir, I don't have group po. I don't belong to anyone. No one wants to have me. You know what I'm saying? So I don't know how we're gonna do that, but let's figure it out on Saturday. Yeah. So we have 2 sections here. Am I right? Do you have 2 sections here? Is that a yes? All right. All right. This is very productive. Very good. Very good. Wonderful. Because this is more interactive and we can learn from each other. And what's good is you can see that we can also get the habits of the others, how others are learning, how others are interacting. Because I want really interactive, especially when it comes to online. Face to face, I don't have much problem because I see you. I see you when you're confused, but online, I have no access. So something that I appreciate. Okay, let's interact with each other. Let's learn from each other. This is the best way to learn. All right. So again, let's see each other on Saturday. Hey, Rika. I see you.
Hi, Doc. Good evening po.
Good evening. Marjorie, Christelle, Quanline or Quanline. Is it Quanline Canley? Nice name. Quanline Canley. Nice. Shania. Juliet. There you go. All right. Good night, everyone. Good night.
Thank
Good
you
night,
po,
Doc.
Doc.
Salamat
Good
po.
night, Doc.
Thank you po,
Thank you
Doc.
po.
Thank you, Doc.
Thank you po.
Thank you. Good night. Good night. Good night. Good night.
Thank you, Doc.
Thank you.
Doc, pwedeng open notes sa quiz. F. Open
you, made,
notes, Doc.
you made me laugh, Brent. Good night. Goodbye. Zach,
Po.
thank you. Bye bye.